Good afternoon. Thank you so much for this opportunity to have the presentation at the SAGES conference. This study was granted by SAGES. The FES has become a requirement for all general surgery residents to complete residency. The exam consists of two components, a cognitive and a manual skills test. While an effective online didactic component to this exam already exists, there are currently few formalized curricula to acquire the necessary endoscopy skills before the exam. Therefore, SAGES supported this study to develop a curriculum for the exam. And proficiency-based skills training, which uses expert-derived performance goals, is considered an optimal training method on simulators. It has been shown to be more effective than time or repetition-based training. So we previously developed a proficiency-based endoscopy skills curriculum for the FES exam. For the cognitive skills test, a multiple-choice questionnaire was developed based on the FES online didactics. For the manual skills test, endoscopy experts selected 5 training modules and simulator-generated metrics on the GI Mentor simulator, which is used for the FES exam. These modules were considered to be representative of the FES exam tasks. Then expert-derived performance goals were defined for each module. Study aims included assessing the feasibility of its implementation in surgical residency programs and its effectiveness in enabling learners to successfully complete the FES exam. The residents from 2 general surgery residency programs in Indiana participated in the study. And after baseline endoscopic skill assessment, residents were required to review online didactics and practice on 5 selected training cases until proficiency levels had been achieved twice. And once residents completed both, post-tests were administered using the same metrics as baseline. These assessment tools were used for baseline and post-training tests. Cognitive skill, psychomotor skills and workload on simulator endoscopy cases were, and 1 gastroscopy and 1 colonoscopy cases were compared between baseline and post-tests to evaluate the effectiveness of the curriculum. For psychomotor skills assessment, participants completed the manual portion of the FES exam. It was not an official exam, but same tasks were used, and we obtained performance scores. 28 surgery residents participated in the study, of which 89% complete the curriculum. Cognitive test scores significantly improved from baseline to post-tests. GAGES, a global rating scale assessed by an experienced rater, and NASA TLX, which is a self-reported workload, also improved after training. Psychomotor skill scores on simulation cases improved, with the exception of Mucosal Inspection, which did not show significant improvement. Bivariable analysis showed positive correlations between mucosal inspection score and task completion time on the gastroscopy case. When the residents complete the task quickly, the mucosal inspection score was lower. And performance on the manual portion of the FES exam improved as well, but the improvement on the mucosal inspection task was insignificant, which was similar to that on simulator modules. And overall scores on the FES manual exam significantly improved. 84% of participants who complete the curriculum achieved a passing score, which was a higher rate than the previously reported pass rate of PGY5 residents. However, despite the effectiveness of the curriculum, 16% did not achieve a passing score. Are there any differences between residents who passed and failed the exam? Despite the difference in FES scores between them, no significant difference was found in regard to PGY amount of training or performance at baseline or post-tests. However, among these metrics, GAGES scores were lower in the unsuccessful group, even though they were insignificant. In addition, bivariable analysis showed moderate positive correlations between FES overall score and GAGES scores in both gastroscopy and colonoscopy. The residents with a higher gauge score performed better on the FES manual test. One of the important findings of this study is that mucosal inspection skill did not show significant improvement, neither on simulation cases nor the FES manual exam. And although participant skills on the other metrics improved after training. Previous studies reported the same finding during the implementation of a similar proficiency-based curriculum. This is one of them, using a different simulator for training. On the FAS exam after training, only mucosal inspection skill did not show significant improvement. One possible reason is the trade-off between speed and accuracy. So the results showed when the residents complete the gastroscopy task quickly, the mucosal inspection score was lower. So as a result of familiarization with the endoscopy, residents may have moved the scope faster than the required time by simulator to record correct visualization. Then accuracy of inspection may be declined. Another reason is an issue of how the simulator calculates scores. So this finding was consistently found in different studies. So it raises a question about the validity of the task and its metrics. Are the task and metrics sensitive enough to detecting a minor change in performance? The reality is that some previous studies reported construct validity, but they were on limited tasks or only between novices and experts, and the results were inconsistent among studies. Another point for discussion is what predicts the result of the FES manual test. The results showed residents who obtained a higher gauge score performed better on the FES manual test. So gauges may be predictive of pass or fail in the FES exam. Importantly, any of simulator-generated scores on simulation cases did not predict the FES manual test score. It also supports a previous hypothesis about the validity of the simulator. But the sample size of this study was small, so more number of participants may be required to qualify them. In conclusion, proficiency-based endoscopic skills curriculum was successfully implemented in 2 general surgery residency programs. Majority of them acquired skills enough to pass the FES exam. This curriculum may prove valuable to other residency programs. Thank you, and I will take any questions.